Harmony TPV that Medtronic has curated has really been transformative for our patients.
The fact that we had a chance to work with Medtronic closely in the design, I think, has really made a huge difference in terms of the way we feel towards the technology.
Because nothing like this had existed in the past and our patients were needing surgery to get new pulmonary valves, this has really changed the field of pediatric and adult congenital cardiology.
The design of the Harmony TPV has this beautiful hourglass shape, which fits beautifully within the surgically augmented outflow tract of the right ventricle.
I think the neat thing about the Harmony transcatheter valve is that it is so conforming to the anatomy that's present. I think it's a really cool idea that you can implant the valve and it conforms so well to the tissue that's around it, that it's not causing problems pressing on structures.
And in the middle has the waist that is where the valve is housed. So this is going to stop the regurgitation.
Because of the Harmony TPV is so soft that I feel very confident that it's going to conform to the anatomy nicely and not cause any damage.
It's very rare now with this technology, with the Harmony TPV, that we go into a procedure and come out of it not having done what we intended to do.
Medtronic came up with a beautiful design. It was exactly how it needed to be. When I use them, I don't think it needs any modification at all.
All interventional cardiologists do what we do, right? From before the procedure to after the procedure, you see a change, a huge change. So it is something that you see like right there and right now. So to me, this is why I do what I do.
In my experience, when the patients receive a Harmony transcatheter pulmonary valve, it's remarkable, actually, the improvement that they experience. So most patients say they feel better almost immediately the following day. They say, I just feel so different.
With the Harmony TPV, you can really feel the tension in the room dissipate. And I love having the actual valve and delivery system so that I can show the patients and their families exactly what is going to go inside of them and how it looks and how it will work. I think that really helps ease the tension as well.
The biggest thing that I sense is relief. They are so relieved. They cannot believe that this valve implantation that they were so worried about years ago, they knew someday this was going to have to happen. And they just can't believe how easy it was for them.